Hello, my name is Giridhar, and today I'm going to be talking about heart cancer. So first I'm going to be talking about an overview of the cardiovascular system and what is cancer. Then I'm going to be talking about cardiac tumor, more specifically its diagnosis and treatments. So first let's start with an overview of the cardiovascular system. So basically the heart pumps blood to the entire body. It transports oxygen, nutrients, and other useful substances around the body. It also removes waste from the body and cells such as carbon dioxide. And the main components of the cardiovascular system are the heart, blood vessels, and blood. So here's an anatomy picture of the heart. So basically, it's separated into four chambers. The atrium, which are the upper and smaller chambers, are responsible for receiving the incoming blood into the heart, and the ventricles, which are the bigger chambers in the lower area, are responsible for pumping blood out of the heart and taking it to the rest of the body. When oxygen depleted blood comes into the heart through the right atrium, it then goes into the right ventricle, where it is pumped to the lungs through the pulmonary arteries. This is the only time in the body that the oxygenated blood goes through an artery. Once the blood is back into the lung, it receives the oxygen it needs. This newly oxygenated blood comes back to the heart through the left atrium, and then it goes to the left ventricle, which pumps the blood into the aorta, which then transports it to the entire body. This way, all of our cells get the nutrients and oxygens they need. So how can cancer appear in the... So now I'm going to talk about an overview of what is cancer. So in cancer, abnormal cells grow uncontrollably in your body, and the immune system can't identify because they're primarily your cells. And they can start in one organ, but then spread to other body systems. And in 2018, it was a cause of 1 in every 6 deaths, according to the World Health Organization. So now let's talk about how can cancer, like the cardiac tumor specifically, how can cancer appear in the heart? So most time, cancer in the heart comes from as a sarcoma, which is a type of cancer that originates in the soft tissues. Heart cancer is extremely rare. For example, in Mayo Clinic, on average, only 1% is seen with heart cancer per year. Most commonly, there are cancers that originate around the heart and then come to involve it. For example, breast cancer or lung cancer. And these cancers can grow to involve the heart and the lining around the heart, which is the pericardial sac. And cancer can also get to the heart by the bloodstream. And cancers that may affect the heart include lung cancer, breast cancer, esophageal cancer, kidney cancer, leukemia, lymphoma, and melanoma, among others. So now let's talk about diagnosis. So there are two main ways you can diagnose heart cancer, which are imaging and then tissue diagnosis. So imaging, it provides information about mass size, anatomical location and extent, functional implications related to flow obstruction, and vascular involvement. These include echocardiography, cardiac MRI, and computed tomography. Now I'm going to talk about tissue diagnosis. So there's a pericardial fluid, which is a fluid that accumulates around the heart, and it can be used to diagnose a cardiac tumor. And when you have cancer, is a really common way of seeing and examining it is through a biopsy, but in the heart it's really hard because it's always pumping. And so a biopsy can be done, but it has to be made by surgery, and then the tissue removal has to follow it in the same surgery. So it's a little bit, it does not come as often as you would see it in other types of cancer. So now let's talk about treatments. So the course of treatment, they depend on several factors such as your age, medical history, extent and location of the disease, tolerances with specific procedures, medications and therapies, and expectations of the course of the disease. In most cases with cardiac sarcoma, it spreads to other parts of the bodies, making the treatment even more challenging. And you can have a heart surgery or a heart transplant. A heart transplant can be attempted when the cancer has advanced to a state that is impossible to recover the cancerous tissue, and a new heart is necessary. And there's also autotransplantation, which is a method where the heart is taken off the patient's chest, and while the heart is being operated on, the patient stays in a heart-lung bypass machine, and after the tumor is surgically taken out, the heart is put back into the patient. Other courses of treatment may include radiation therapy, chemotherapy, targeted drug therapy, and immunotherapy. Yes, thank you. That's it for today. Thank you for watching.